everyone. Welcome to Digital Health Talks. This is Megan Antonelli, and today I am here with my friend Janae Sharp. It has been, over a couple months since we've recorded a 5 Good Things episode, and we are excited to join you. I don't know if we're going to find any good things this month or even digging into the last few months, but we're going to do our best. Hi, Janae. How are you?
I'm thrilled to be here today and talk about good things. It has been a bit odd. I mean, we did suggest maybe we do something we're grateful for. Maybe we do things we're looking forward to. Because we have to be honest, like there's some pretty staggering, weird and bad news in healthcare. So, and I think part of why we should still do this though, is that can be distracting. Like there's so much noise going on and so many people just like, you're like, whoa, I feel like I'm getting hit in the face with a bunch of flies going down the highway of bad news, but like, how do we stay focused and make progress when things are just seem terrible?
Well, and I think it goes back to where this was born from, right? It was born on the floor of hymns right after the pandemic, the first hymns where we were like, we want to talk about good things. And so there was plenty of bad things still happening. We were coming off of a bad time and we tried to find the silver lining. So
yeah, not that I'm anti-reality TV. I'm pro-rage bait. Like I sometimes go and doom scroll out of joy. Like Schadenfreude is part of my life, but let's stay focused here. Like how do we bring ourselves out of it? Yeah.
So we can start with the good things that happened in October and November at the conference. It's conference season, which I can blame the summer. I can blame a lot of things for us to not having a chance to record. But as the September, October, and November came off, there were just event after event after event, and they're still going. I think we have RSNA next week or the week after the holidays. So we went to Health, which I thought was the best health I've been to. I think that everybody's got a different opinion, but for me, walking the floor, seeing the floor, there was a lot of energy. It was really well organized. It was really well.
They do such a good job. Like they do a good job.
They do.
And they bring in things that are kind of innovative. They got to play pickleball with the Weight Watchers people.
They did.
I always thought, like, I hate it at events when you're just like, okay, so we're talking about health, but what we're really going to do is sit around and then go to a happy hour. It's like they're anti-health.
We did plenty of that too. But the pickleball scene, the Weight Watchers, the Weight Watchers setup was amazing. It spoke to the Long Island Hamptons lover in me. It was just perfect from start to finish. So that was great. But, overall, they had a shit sandwich to deal with in terms of the government being shut down, not having a lot of speakers. And I can only imagine the scrambling that had to go on to make sure that agenda stayed great, stayed current and really delivered. And it did. I think Mark Cuban's keynote was, it was interesting, and he really is trying to disrupt a very broken part of the healthcare system. And he explained it all really well. I don't know if there were actually people in the audience that don't know what he said, but if there are, it was really good that they heard it. And it's
really helpful. Just
a noble cause.
There are a few groups that are kind of working in the in-between spaces, also where there are market fit. There are market opportunities that we don't always hear about in healthcare. But speaking of that is another good thing. Government's back on.
Oh, yeah. For better or for worse.
Let's go back to Mark Cuban though in health though. Let's maybe we should talk a little bit about other events that are great because
we had a chance. We went to the American Heart Association scientific sessions, which is also one of my favorite events of the year because we get to see physicians and clinicians get super excited about healthcare, but I will say, or about digital health, one of the things that stood out on the floor of the the health tech pavilion was they did a stump the doctors with the AI tools.
What?
It was amazing. And AI didn't wash the floor with them, I think, but it was close. And there were a lot of times where the AI got it, and the doctors wanted to order another test. And so it was very representative of really what all of this, what we're working towards and all of this, because at the end of the day, what I walked away from it was doctors with AI are going to be a stronger tool, right? And we didn't have that category. We had the doctors alone, in a team of doctors looking at the challenge, at the problems, at the cases, and then a number of different AI models. And so what we needed, and next year, hopefully they will also do, is a team of doctors with AI and AI alone. And
I like that. Yeah.
Hopefully we see the winner that we expect.
Yeah. This isn't quite like the robots playing chess. We're not there yet, right. But let's get into it. It'd be cool too. I feel like if they displayed the logic behind it, like, wouldn't it be cool to be watching that and to see like kind of the thought process? Well,
and I mean, so on the physician side, we did get to see it. We got to see them kind of debate whys or hows of what they were going to pick, which was amazing. The questions were also really hard. I don't know if I did it again, I might give them easier questions because they were definitely hard.
It's probably just like the QBank exam,
Right. Well, I'm
the sure study manual, and then the real questions, you're like, wait, what?
Right. Well, because like some of it was like 64% to 72%. Like there were just like not that much of a deviation, but the physicians who participated were real troopers. It was a great session. I had session envy. So that was fun. And then this past week we were at AI Med, and I didn't get to go over to Behavioral Health Technologies, Salome's event, but I've heard
so many great things about that event. Like she's just killing it.
Yeah. And there's just, and then of course Chime happened at the same time, the same week. So there's just been so much in terms of conferences. And then
also we had a virtual event.
You did. You had your virtual event and that went amazing. I can't believe how many attendees you got. Congratulations.
I loved it. I also, I loved that we were able to like support nonprofit work, and one of my favorite sessions also was with Sachin Jain. He was in the hot seat. I asked him, I was like, this is just a random idea. Like he like brought a real issue to work with a coach live. And I was like, you gotta be bold to come up and be like, I have a life question. Let's do this live and talk about, insurance, future of medicine, like the meaning of medicine. So I liked that. And it's just amazing to have that event where you kind of feel inspired by how many people care. A lot of the times in medicine, it can get overwhelming. It can be a bit of a grind, like hearing about all this stuff, especially right now when everyone seems to be pretty full of hate. I don't know if it's just like AI bots online, but there's a lot of people who are not happy. So I thought it was a great thing. Well,
I will say, his perspective and what he shares online, at least, what I see of his sharing on LinkedIn is always, so thoughtful and, and really a breath of fresh air because he really does. He comes at it from both sides. He gets it. I was saying to someone the other day, just as we're planning our events and looking to 2026 and what we want to do, that someone might have been you actually. But look, I don't talk to that many people. But there was a time when my job was easier, when it was like, here are all these shining stars who are undoubtedly doing amazing things in healthcare, trying to fix the system. And I think, and the problems they were trying to fix were access, quality, patient safety, and they were pretty clear. And now it's just so much more convoluted, and the systems of, and to some degree, there's this recognition that the systemic problems go so much deeper, and they tie so much more deeply to the broader problems across the country, that what they're going to be, how we're going to be able to impact it just through our healthcare lens is not as easy, and it's just been harder to find folks like Sachin who are, kind of tackling it from at that level, right? Because if you're not, you're just fixing. It's almost like you look at Mark Cuban. He's fixing a little piece of this. It's a big dollar piece, and it has significance. But how it will impact, patient care or patient outcomes, it's an access issue. It will get people cheaper drugs, but not all drugs. It won't impact, newly, sort of new off-market drugs, new on-market drugs. So there's a lot of the big sort of big dollar, big impact where people get impacted, that doesn't change. So back to the government. Yes, it's open. It's back.
Yeah.
Been a busy
we don't
week.
know if ChatGPT was used while they were closed, because some of the stuff they're putting out is a little bit like maybe someone should put it through another edit.
As per usual. Well, and then, right. I mean, and the SNAP benefits are reinstated, but not really having entirely to do with the administration, but luckily a federal judge in Rhode Island who kind of brought those back on. But that brings us back to SCAN health plan. And one glimmer of good news that we found.
That we love.
That we like. So Costco and SCAN have entered into a partnership to expand cost savings.
And I don't know about everyone else who's watching this right now, but I love Costco. Like Costco has a great model. They have people who love to work there. Like they also, during like all this like gobbledygook about politics and like identity politics, blah, blah, blah. Like they're just like, we're not going to do that because our people don't like it. So I kind of like an organization that's just like, you just hear great things. And then, I love an insurance plan that's like, let's go to the best, Right. So I am an unapologetic Costco lover.
Well, and it comes down to, what is it? It's basically they're offering like a savings day for older adults.
And we were not sponsored by Costco.
We weren't. I'm not going to comment about Costco because politically and as an organization, I love it. But as a shopping mecca, I am not a huge fan.
Just because you walk in, you have to spend money, whatever. We won't go there. The point is they made a partnership. And one of the things it does is help pay for things that are normally hard to get. One of my kids needs glasses. It's really hard to find vision exams, especially within your insurance plan. So sometimes people just go to Costco because it's cheaper. So I think it's smart when people hear that. They're like, okay, well, what if we just partnered with the place that's easier to go to?
Right.
It's such a practical.
Well, and it is. I mean, it goes to the whole, and back to health, Kroger was there, Instacart, there's a lot of these, larger platforms that are, of course, Walgreens was there and all of that. And I think that they, giving people healthcare where they are is important. And this, there was a food as medicine pavilion, of course, at Health. There was also one at the American Heart Association, which is huge because the American Heart Association, very much so when we talk about, heart health in this country, it goes to cholesterol and statins and all of that. And food is not necessarily our first line of defense. And I think that's shifting. We had a great conversation this week with Dr. Elizabeth Clotos of Step One Health. There were a number of food delivery services on the floor at Health. And I think, we've been talking about food as medicine for a long time, and the importance of that is not lost on both, this administration. I'm just going to keep saying for better or worse. I can't actually not do that.
Like Dr. Oz told us that if you're healthier, your insurance costs less. I just felt like a slow blink. I was like, is this a Saturday Night Live sketch? So you're telling me, let me get this straight. If you're healthier and you don't have to spend money on healthcare, then it's going to cost less. Like I was like, I feel like I'm taking crazy pills. This is such a Zoolander moment sometimes for me.
It is.
I mean, I get it. Like the spirit is like, let's have initiatives where we're striving towards health. But at the same time, that's like telling people if you're stressed, just have more money.
Right.
Just like have an easier life. Like,
well, among the other very intelligent and smart things they had to say this week, they changed the messaging on vaccines and autism on the CDC website. So that, without science, without evidence, they are going ahead and making changes. And it hasn't.
It's just like people they're like, autism's awful. Like it doesn't even bother me that much. Or when they're like, make America healthy again. I'm like, which portion are we talking about here? Like, because historically, like we didn't do that great. Like our health outcomes are actually, first of all, they're not as good as other developed countries, but also they're kind of better now than they were, So I feel like we're kind of grasping at straws and like taking this whole thing. It reminds me of like training when you're training for religious stuff, testify, tell them, like appeal to their emotions, talk about loyalty. It's really weird. It's a weird feeling. I get it.
It goes back to something that we talk about a lot in the digital health world. And it speaks to the fact that in medicine, we're always looking for the evidence. This is the scientific method, the science of all of this. And they don't seem to have the appreciation for it that perhaps those who have worked in healthcare their whole lives do. But yet, there are certainly people within the administration who are trying to do the right thing and who are doing the right thing. And we know that the healthcare system is broken. There are misaligned incentives. We know that there is change that needs to happen. And so at the same time that they're putting up, things that I don't agree with around, changes in vaccine recommendations that will then create more fear or create more uncertainty around whether or not people should be giving their children vaccines, and adding to the, measles, outbreaks around this country and internationally. And then I don't even want to go into their recommendations around, gender dysphoria and all of that were literally, a video that looked like it was from a sci-fi show of this, of the assistant directors talking about what is going to be the right or wrong.
Oh, like the script was a bad AI copy from that Apple show,
Yes. One of the ones that my husband,
I was just like, wait, guys, did anybody catch the guy who wrote this? Because it's giving like failed republic. It's giving these people like, are they sabotaging them? I wonder sometimes. I'm like, this.
Right. We found 9 academics who would agree with us, and therefore we are going to publish a report on it. We're going to put it through ChatGPT, and we're going to put a bibliography together that has a bunch of links that don't actually work. And then we're going to make a YouTube video and put it on the website.
I think it's a distraction. First of all, it's ridiculous.
Right. So that was HHS. We've got the CDC with the vaccines, and then on the other side of the arms of government or arms of the healthcare, we've got the FDA removing the black box warnings for menopausal hormone replacement, which
great news.
I'm excited about, right? Because I feel that those have been there based on a study that was not as reliable, not, sort of debunked a long time ago, but we've maintained it and we've depended on it for a long time. But it does then, even for me who, consider myself someone who does pay attention to this and maybe has some understanding of it.
We always talk about menopause stuff. We love menopause. But I love it,
Right. But at the same time that I am, easily, sort of eschewing the other information as incorrect and bad judgment. Here I am like, oh yeah, sign me up. Give me the estrogen right now. Where's the patch? Put it on me.
Yeah.
So
a real mixed bag.
Yeah. So we don't know what is true. We don't know who is right. And we're just left kind of trying to figure that all out and hoping that maybe ChatGPT will tell us.
It won't.
Did we get anything good? I don't think there's any. I mean, it's the FDA black box warning. It's good. It's a good thing.
Yeah.
It will hopefully lead to additional studies.
I guess our good thing for the government people is like, hi, we see you. This is a lot.
Right. For being closed, you sure did a lot this week.
Yeah. And also, like, why are you making me agree with, my friends from the Cato Institute that are like, maybe government should be smaller? Why do I relate so much with like the British government people and how they just mock their politicians relentlessly? Maybe we need to get more of that humor and like, because it's a lot. This is a lot.
It's a lot. I mean, I found myself, which I never go to X anymore. And I just went. I probably went because I wanted to see what was going on with the Epstein files. But what I found was just horrifying. It was horrifying. And none of it had to do with the Epstein files because, as you said, it is all a distraction. It's all just, kind of trying to create outrage. And it's a tough spot to be in right now. I don't envy, true academic researchers who are really trying to, solve these questions, which brings me to one more really great thing.
We're ready for it.
Which was this past weekend, Paulo Machado, a friend, a Pink Sox comrade in arms, who I actually saw at Health, invited me to attend a fundraiser for the lung cancer actually, it was a friend raiser, which I loved. It was a friend raiser for the Lung Cancer Foundation of America. The founders were there, the executive director, the dean of UCLA Medical School. And so I learned about the work that they do. Oh, there's Hirsch. I learned about the work that they do, and what they do in terms of their funding is they actually focus on funding early stage researchers working on lung cancer. And of course, they talked about how funding has been, cut, reduced, especially at the university level. And that, we're kind of sort of in a crisis phase. But they also talked more generally about lung cancer in that because the stigma is attached to it, of, sort of blame of, these, people smoke and before they get lung cancer. But what they talked about was that, in fact, over 50% of the people diagnosed with lung cancer weren't past smokers, and that there's a number of people that fall through the cracks, and that 3 times as many people die of lung cancer than they do of pancreatic, breast, or colon cancer. So it is such a serious, problem. And we, at the same time, because of the healthcare system that currently exists, the established medical system, the funds go elsewhere. I
do think that also tells us a little bit about opportunities that everyone has. Like, we have so much noise happening online, but, some of that's marketing. These large groups are just churning it through like a business to make money, to do research, and lung cancer hasn't been as lucky. And I think the same is true of mental health. Like, it's tough with mental health, but like,
right. Well, what's interesting about why
people make news, it happens. Oh, what was interesting though?
And mental health is the same way, is that with lung cancer, because it's found so late, that the death rate is so high and the survival rate is so low, there aren't advocates for lung cancer because they're not. But luckily, thank God, with breast cancer and other diseases, people live through it and therefore, really come around it. So that stigma attached to those, sort of poor survival rates. But that what was great about it, and for me, of course, I lost my mom to lung cancer. I was surrounded by people who had the same surgery that she had, who had survived, and the survival rates are getting better and the treatment is getting better. And, it's not, it's not something not worth funding. Right. And it's the same thing with mental health. People with mental health challenges, it's harder for them to go out and advocate for anything. So,
don't tell them to do more.
Right. So, that puts us in a position of doing that, which of course you've done so amazingly for the Sharp Index and for.
I do feel like part of that is like, you realize you have other people who have been through it. It's like they say, if you want something done, go to someone busy. If you want help, go to someone who's needed help, and really individuals have been there for me, but also whenever you have an issue, a lot of the times you can find other people who have been through it to support you. Mm-hmm. And that's one of the things, being online can be a real drag, but it can also be an opportunity to connect with people who are empowered to show up. And some of these questions also, I think, go into this larger question. Like you were saying, the system is flawed, like who should be responsible? And it goes into the question of like, who should be responsible for fixing things? Healthcare? Is it your doctors? Is it society? Like, what is it that we really need here? And how are we going to get there?
Well, and that's one of the sort of the silver lining of the administration's negative impact on current funding throughout the academic medical systems is that they are looking for alternative paths to fund that, which then, will lead to maybe, to some degree, more objective funding of these things, right? Where you put it to the patient, where you put it to the community, and they drive where the focus is. Because I think, if you go around a room, the amount of people who have been impacted by lung cancer is so high. And
I haven't, but yeah.
Yeah. I just think that there's so much around, the screening even, right? So, and there was just the article in the Times, I think a national story about, women who aren't eligible for screening. So you're not eligible for screening unless you are 60 years old and smoked for 10 years a 20 pack a day habit, or not 20 pack a day, a 20 pack habit, which is equivalent of a pack a day for 10 years or something like that, which is
crazy.
It's a really high benchmark. So regardless of the fact that like you're not, eligible for screening without reaching this, and that there are 20% of people who have never smoked do get lung cancer, and it goes also back to social determinants of health, of where you live and where you work that impacts that. So there's a lot of work to be done, and it's not all around science, but around the evidence to then change the recommendations, which goes back to, exactly what the government is doing right now, which is changing recommendations without science necessarily. So,
so let's hope that other people can step in and like create more certainty for, for people who are dedicated to improve health.
Yeah. I mean, and finding more people and more voices and amplifying those voices of people who are really trying to disrupt the system that exists there, right? That system of, where the research is happening, where the funding is going, what is truly broken is not that we didn't spend enough money on our EHR this week. I mean, there's more to it, which brings us, of course, to our last good thing, which is that we're planning for Health Impact.
Yes.
Did I forget anything else?
Probably, but let's just move on.
Well, the next Health Impact is going to be February 3rd and 4th in New York. We are excited to go to New York in February. It will be amazing. It's never that cold because of global warming.
February is less busy. I kind of like that.
It is. It is.
And everybody loves New York. Let's face it. Everybody knows a guy in New York.
It is very fun. We always have a great time. And I think what we are focused on for 2026 is kind of the builders and the architects of the future of care everywhere. And then what we, want to focus on in terms of the keynotes, and that the folks are kind of the disruptors. I want to hear from those who are, really doing something to change the system. So we're going to invite Sechin, and we're going to invite some others who have really done some significant demolition, if you will, to the current system. So that's what I'm in for the demo days.
This is a different type of demo, right?
Right. Oh, maybe we'll play on that. What?
Yeah. So everyone,
I love a pun.
Like, we want you there. We want to hear your ideas. If you want to partner, thrilled to see everyone.
Yes. It'll be great.
And also make sure that we don't have to look for good ideas anymore, because that's exhausting and it leads to doom scrolling. So please tag us, send us your good ideas, email us, follow us everywhere, share everything we ever say. Just kidding. Sort of. Subscribe. We want to hear what's the good news. What's great.
We do. We want to hear about all of it. All the good stuff that people are doing, because I know they're out there. It's just that it's a lot easier for the bad news to make bigger headlines and kind of get that attention. But, we had some good things this week. I think, lung cancer screenings, catching cancer early, all of those things are important. And scan health, food is medicine. And of course, estrogen. Estrogen is a really good thing.
We do love women's health, and I think it's important to realize things will not be business as usual. So don't get so overwhelmed by all of this that you don't do something positive.
Well said. Well said. Well, thanks, Janae. It's always a pleasure.
Thank you so much.
Thank you, everybody. And speaking of thank you, have a fabulous Thanksgiving. I hope you'll have very wonderful times with your family, and have to talk about politics. And
yeah, we're hoping that your Thanksgiving discussions are not weird with that one uncle.
And thanks everybody for joining us. This is Megan Antonelli and Janae Sharp signing off with Digital Health Talks. Till next time, be sure to tune in to Health Impact Live to check on our upcoming dates and all of our on-demand content that's available 24/7 for you to listen to.